All right, so we're going to get started. Good afternoon again, and welcome to our Wellbeing Webisode, learning how preventative screenings can protect your health. I am Kelly, a health services specialist with Geisinger, and today with me I have Emily Lorenzen. Emily is the quality nurse manager with Geisinger, and she's a licensed practical nurse. Today we're going to be talking about what preventative care is, and identifying how staying up to date on preventative screenings is one of the most important steps we can take to live a long and healthy life. I just like to add in a disclaimer that all of the information provided today is to increase your awareness. It is not specific medical advice. Any specific medical questions, you should direct it to your doctor. But welcome, Emily, and thank you for joining us today.
Thanks for having me.
So I think most of us have a good understanding that when we are sick, when we get hurt, get injured, it's important to go and see our doctor. But there are times when we should be going to a doctor even when we are feeling well and healthy for preventive care. Emily, can you explain what preventive care is and how it is different than the standard approach of going to the doctor when something is wrong?
Yep. So preventative care is actually considered any measure that a person is going to take to help prevent disease. So really the difference between preventative care and going to a doctor when you have something wrong would be that preventative care, you're trying to prevent an illness or a disease from occurring. So you're having testing, you're having a conversation with your provider. Something's going to occur where you're talking about that prevention piece. When you're going to the doctor because you're ill, or you're injured, it's because you have an issue, there's already an issue there, and you're looking to treat that issue. So the goal of preventative care is really to have that conversation, to have that testing, and to identify any potential issue that you might have or that could happen and minimize the need for extensive treatment. So, and a couple of examples of preventative care would be going to your doctor for a well visit, having a screening colonoscopy, a screening mammogram, just a couple of examples. There's more out there.
I kind of like to think of preventive care as a more of a proactive approach to your health than rather reactive. Um, and I would think being proactive with your health would be beneficial. Can you explain what some of the benefits are of staying up to date with your preventative care?
Yeah, so there's really three main benefits, right? So ultimately, it reduces the risk of disease, it reduces the risk of disability, and it reduces the risk of death. So, according to the United States Department of Health and Human Services, preventive health screenings and primary care consultations, those well visit with your providers, are found to significantly increase life expectancy, and they're also it proves that people who have that preventative care typically have healthier health outcomes. So you're identifying issues earlier, you're getting them treated earlier, and the outcome is typically better than if you wait and you find something and um, it's already at a stage 4, stage 5.
Kind of easy to remember. 3 Ds: disease, disability, and death are the benefits.
Yep.
I think one benefit that interests me and sticks out to me is the disease prevention piece. What diseases or conditions can be prevented or delayed or improved with this preventive care approach?
Yep. So most diseases can be prevented or delayed with preventive care, right? But the four that stick out the most and are probably um, most important to most Americans are heart disease, stroke, cancer, and diabetes. They're chronic diseases. And once you have heart disease, stroke, cancer, diabetes, you're more at risk to have other diseases, other disabilities that come along with that. So, the these they lead to death, disability, and these diseases, these four, are actually the leading drivers of increasing healthcare costs.
So that's huge. The most prevalent conditions and the most pricey can be prevented or improved through this partnership with your doctor. adherence to preventive care. So how are we doing with preventive care? Do you have any insight on how US adults do with preventive care? Are we receiving all the appropriate services? Excuse me.
Yeah, so US adults, American adults could definitely use a little push, a little improvement in this area. According to the U.S. Department of Health and Human Services, approximately only 8% of adults age 35 and over are receiving the recommended preventative services. And out of that 35 or out of that 8%, women are actually receiving more of their preventative services than men. So there's a lot of room for improvement across the United States.
Wow, 8%. That's pretty
Yeah,
low.
it's really low.
Um, Yet I feel like you hear about it so much, but it's still low.
Yep.
So how would you say that this lack of preventive care is affecting Americans then?
So it really it kind of seeps in, and it affects a lot of different aspects of a person's an individual's life, right? So when somebody has, developed one of these diseases, one of these chronic diseases, it's impacting their ability to work. It's they're losing time from work, increased medical bills, their families losing time from work. So there's a financial aspect. But then in addition to that, you think about, the person as a whole and how they're feeling, right? And the other things that come along with being sick and not feeling well. You have, the potential for chronic pain. Sometimes depression happens. So all of those things impact an individual's quality of life, their drive to get out there and have those relationships and continue those relationships with their family. It just makes it, and their friends and community as a whole. So it makes it a little bit more difficult, when you contract one of these chronic diseases. There's sometimes scenarios where you can't be out amongst the community and larger populations. So it really, that in itself, can leads back to that depression, the pain. So it's, that's probably our biggest drivers, right? It's going to impact family. It's going to impact finances. It's going to impact the overall well-being and quality of life of an individual.
It definitely has a huge impact on us. You listed all the benefits of preventive care, yet we still have room for improvement. What do you think are some of the common barriers that deter individuals from getting this care?
Yep. So my team works very closely with preventative care and trying to get people preventative care. So we've heard a lot of the barriers. I think the number one reason, or the number one thing that people state, is, they're afraid of the financial impact, right? They're not sure that they have the money to cover it. They didn't have insurance. They're just recently covered by insurance. And then there's always the lack of time, fear of getting a bad result, limited appointment availability with providers, transportation barriers, and more recently, fear of contracting COVID.
So we got lots of barriers to
Yep.
overcome.
Lots of barriers.
I think one that you hit on, many people worry about, is when they seek medical treatment, whether it's because they're sick or injured, or if it's because of this preventative care, is cost, is the financial aspect. Is that something we should be worried about? Are these preventive care appointments, screenings, testings usually expensive?
Yeah, so that's a great question. And that's definitely, I think, a message that really needs to be spoken about, right? So preventative screenings are not expensive. If you have health insurance, it's covered. As long as you see an in-network provider and that or doctor, and that provider is doing the service, it's covered at no charge. So, and when I say no charge, I mean There's no co-payment, there's no co-insurance, and it doesn't matter if you've met your yearly deductible. If you're having one of these preventive services completed, it's of no charge to you.
So that's an easy barrier to overcome if we get that knowledge out there
Yep.
to everyone. So now that we discussed the importance of preventive care, some of the barriers, I know you mentioned a few different screenings like your well visit, mammograms, colonoscopies. Can you outline some of the common preventive screenings that adults should prioritize getting?
Yep. So there's some specific to women and some specific to men, and then there's some that all should have. So obviously, if you think about human anatomy, our women should be thinking about cervical cancer screenings, your pap smears, mammograms, bone density screenings to test for osteoporosis. Men should be getting prostate cancer screenings. And then for both men and women, we should be looking at blood pressure screenings, cholesterol check, blood glucose tests, colorectal cancer screenings, skin exams, dental exams, um, just to name a few.
So how about anything else besides these screenings? Is there anything else that's considered preventive care, like maybe vaccines or?
Yep. Yeah, so that's a good question. So really, realistically, an annual well visit with your provider is considered preventative medicine. It's considered a preventative measure to get your health and keep your health on track. That's probably the number one key is having that annual well visit with your provider. They are going to help talk through any concerns that you might have. They're going to track your history. They're going to help you get the screenings that you need. They're going to know and understand the schedule for the screenings, and they should help to prompt you to get your screenings. Immunizations is a big one. Especially nowadays, you hear immunizations, and I know even, when I speak about it and amongst my friends are like, oh, immunizations, they're for kids, or oh, I'll get my flu shot. But there's other immunizations out there. There's boosters that need to be had. The best thing that you could do is protect yourself. So those immunizations are important.
And they fall under the bucket of preventive care. So would they also be not
Yep,
free, but no cost assist?
correct. Yep.
Um, so I think many of us put off going to their doctor, getting your preventive screenings because we feel like we're young, we're healthy. It can wait till we're older or till we feel sick. Um, Personally, I think you're never too young or maybe never too old to take action. Would you
Yep.
agree with that, or is there a certain age we should start?
Yep. No, so I would agree with that. I mean, honestly, preventative care should start from birth. And it does. If you talk to any of your pediatric physicians, they have well visits, they have immunizations, but then there's milestones and there's screenings that need to be done from that point forward, right? So, and I know, as people grow up and get older, college happens, employment happens, you have families, but realistically, as you start to enter that adult world, from your early 20s on would be a good benchmark to make sure that you're rounding back with your provider on an annual basis and talking through what preventative screenings you need to have.
I think we had one a question in the chat, and I'm thinking this question will maybe go along with that. But you listed a lot of screenings, a lot of tests, a lot of vaccines that are part of preventive care. That can be a lot to keep track of. How do we know what preventive care we need? And are there resources out there for us to
Yep.
reference?
Yeah. So it is. It can be a lot, and it is hard to keep track of, especially when you start, having to track not only for yourself, but for your family, your older parents, maybe a grandparent or a neighbor that you help to take care of. So it can be a lot. So there are a lot of different resources out there. Your provider, your physician is your number one resource, right? So you're going to want to have regular visits. They're going to track that most physicians will give you a checkout sheet and what your upcoming tests that you'll be due for should be listed on there. I know here at Geisinger, we have the My Chart portal. So all of your preventative screening should be listed in there. There's also letters that are sent individually. We do what are called birthday mailers. So at that time, right around your birthday, if you are a Geisinger Health Plan member, you should be getting a letter saying, "Hey, happy birthday. Thanks for taking another trip around the sun. You're due for these screenings." We also do updates in our member newsletter as well. So throughout Geisinger, we have many different types of member and patient outreaches also to help engage members and remind them to that this screening or this testing is due. And we also have resources to help you get scheduled.
Probably not the other one.
Did somebody have a question?
I'll just leave it on the printer. Thank you.
Okay. I think maybe somebody just hit the mute button. So realistically, there's a lot of different ways to track it. Best way again is if you're not a Geisinger provider. I know I work very closely with some non-Geisinger affiliates and some larger health systems, and they have a similar system to My Chart. So that's probably the best place to go to look at that is in one of those portals where your PCP, your physician is linked to that. So then it's all listed there.
That is all the questions I had for today. I thank you, Emily, for joining us, sharing your experience, your tips with us today. I thank you to all who tuned in to listen today. I hope you found this information to be useful and relatable. We do have time for questions. If there are any other questions, you can put them in the chat or come off mute. Wait a minute. Not hearing anything. So if you do have anything that comes up, feel free to email wellness@geisinger.edu and we'll get you the answers. And be sure to join us next month for a conversation on how to improve your life by managing chronic conditions.